CARICOM High Level Team deployed to assist Guyana in resolving election challenges.
Governments take unprecedented steps to keep citizens safe from COVID-19.
And the CARICOM Secretariat establishes COVID-19 task force. These and other stories are in the CARICOM News Time for the period March 6th to 17th. I am Tusankin English Francis.
And I am Michelle Nurse. Thank you for joining us. Several CARICOM countries have recorded the presence of the coronavirus in their jurisdictions.
The government of Jamaica is prepared to deal with the occurrence of the novel coronavirus COVID-19 in Jamaica.
It is my sad duty to announce that Guyana confirmed its first imported case of coronavirus disease 2019, otherwise known as COVID-19, in Georgetown on Wednesday, 11th of March 2020.
We received confirmation earlier today that St. Vincent and the Grenadines has recorded its first case of COVID-19. It is what is described in the literature as an imported case.
2:45 today, we got confirmation of our first case of coronavirus from CARICOM.
As of noon on the 17th of March, Antigua and Barbuda, Barbados, the Bahamas, the Cayman Islands, Guyana, Jamaica, St. Lucia, St. Vincent and the Grenadines, Trinidad and Tobago, and Suriname had confirmed cases of the virus. Governments are instituting unprecedented measures to keep their citizens safe. The measures include closing schools and imposing travel restrictions to and from countries that are worst affected by COVID-19. Several member states have announced that their borders will be locked down to outsiders for the next 14 days. Only nationals will be allowed entry into those countries.
Trinidad and Tobago will cease to encourage and facilitate for the next 14 days entry into our country except under exceptional circumstances, the entry of persons who are not nationals of Trinidad and Tobago. Exemptions can be had to that, as we must, but those exemptions will come from the Minister of Health through the Minister of National Security. For example, our CARICOM workers, health personnel, and similar essential persons who we need would have to come in, and therefore such persons would be exempt.
Prime Minister Andrew Holness of Jamaica has declared all of Jamaica a disaster area amid the coronavirus. As of the 16th of March, Jamaica had the highest number of cases in the CARICOM region. The government has quarantined the communities of 7 and 8 miles in Bull Bay, St. Andrew, in an effort to stop what is now effectively a local spread of the virus.
The government has been very proactive in securing the health of the nation by instituting travel restrictions, quarantine protocols, and informing the public. We have also identified and invested in preparing additional spaces for quarantine and isolation. The Ministry of Health has been fully mobilized, and our technical and professional experts and technocrats have been sensitized. I have every confidence in our medical professionals, our public health officials, and our administrators in managing the situation.
The first recorded cases in the affected CARICOM member states were imported from COVID-19 hotspots in Europe and North America, except for the Bahamas, where the patient had no travel history within the past 20 days. The virus that has killed more than 6,000 people worldwide has so far recorded 1 death in CARICOM. The first person who tested positive for COVID-19 in Guyana died on Wednesday, the 11th of March, the same day the World Health Organization declared COVID-19 a global pandemic.
The alarming levels of spread and severity, and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
St. Kitts and Nevis is among the several other CARICOM member states which so far have not recorded the novel coronavirus. The Timothy Harris government is, however, taking all precautions, asking persons in coronavirus hotspots not to travel to the island at this time. Persons who do travel to St. Kitts and Nevis from those destinations will be subject to a mandatory 14-day quarantine period confined to a designated facility. CARICOM governments are advising against social, religious, and sport gatherings.
The Secretary General is heading a COVID-19 task force he established to lead the response as the situation evolves. The task force, which includes public health, management, and communication specialists, will coordinate the Secretariat's implementation of measures to minimize the transmission of COVID-19. All non-essential official travel has been restricted, and as far as possible, meetings will be convened electronically. The Secretariat is also encouraging staff in certain cases to work remotely, as it encourages the method of social distancing to prevent infections. The Secretary General has also encouraged staff to take personal responsibility in minimizing their risk of infection.
COVID-19 has been a concern for the Caribbean community since it first manifested itself in China in December of last year. Initially, the Caribbean Public Health Agency, CARPHA, which is responsible for conducting these types of assessments in consultation with the World Health Organization and other relevant organizations, determined that the region's risk was low. That risk has since been upgraded to very high, and it has been declared a pandemic by the WHO. Concerns have therefore understandably increased, especially with confirmed cases reported in all our host member states. I want to assure you that staff health and well-being have been and will continue to be the primary focus of the Secretariat's response to this threat. Enhanced sanitation of the work environment is taking place regularly. I want to encourage you all to take all the necessary measures to prevent contracting and spreading the virus. Wash your hands with soap and water or use a sanitizer with at least 60% alcohol. Cover your nose and mouth with a tissue when you cough or sneeze. Dispose of the tissue immediately and wash or sanitize your hands. Sanitize areas you touch often, such as doorknobs and telephones, and wash your hands. Avoid touching your face and wash your hands. I cannot stress enough the importance of washing your hands regularly. Maintain social distance of at least 6 feet from persons, especially those with symptoms such as coughing and sneezing.
A high-level team from the Caribbean community was in Guyana to support a recounting effort of the ballots of the March 2nd general and regional elections. President of Guyana, His Excellency David Granger, requested support from the chairman of CARICOM, the Honorable Mia Motley of Barbados, to field an independent high-level team to support a recount of the ballots cast in the elections. He said this was to satisfy the questions raised by the observers and the citizenry.
In response to the CARICOM initiative by the 5 Prime Ministers, I agreed that a total national recount could be done to satisfy the questions raised by observers and the citizenry. I had a telecommunications conference with Prime Minister Mia Motley today, 15th of March 2020. I proposed that the CARICOM initiative should operate within the legal framework of the Constitution of Guyana and respect the role of the Elections Commission and the rulings of the Supreme Court.
CARICOM chairman described the CARICOM-supported recount as a giant step in being able to determine the will of the Guyanese people in the elections.
It will also allow the electoral process to regain the confidence of all locally, regionally, and internationally. I have spoken directly to both the President and the Leader of the Opposition, and they have committed to abide by the results of a fair and transparent recount of each and every ballot as supervised by the CARICOM team.
While the count was originally scheduled to begin on March 16th, it was put on hold to ensure that the legal issues were properly addressed. A statement from the Elections Commission said that it had considered the signed agreement between the President and the opposition leader, witnessed by the CARICOM Secretary General. While it had implemented systems for the recounting exercise, GCOM said as a safeguard mechanism, it was addressing the legal issues, including the gazetting of the process, as requested by the CARICOM High Level Delegation.
The CARICOM Chair had led a prime ministerial team to Guyana from the 11th to the 12th of March amid heightened tensions and concerns about the fairness and transparency of the electoral process. Dominica's Prime Minister Roosevelt Skerrit, Grenada's Prime Minister Dr. Keith Mitchell, St. Vincent and the Grenadines Prime Minister Dr. Ralph Gonsalves, and the Prime Minister of Trinidad and Tobago, Dr. Keith Rowley, accompanied Prime Minister Motley to Guyana.
We met with the President and we met with the executive of APNU. We met with the Leader of the Opposition, Barrett Jagdeo, as well as the members and the presidential candidate, Mr. Irfan Ali, and other members of the executive of PPP. We also met with the representatives of the small parties. We met with the election observers. And then again, we met with the President and Mr. Jagdeo very late last night, early into the morning, together in order to be able to chart a process forward.
Prime Minister Motley said CARICOM is committed to working with the people of Guyana for a free, fair, and transparent process.
And we made it clear because there is simply too much at stake for the people of Guyana. Georgetown is the home, the seat of the Caribbean community. Guyana is a founding member of the Caribbean community. And against that background, we are clear that as a community of sovereign nations, we cannot get involved in the internal processes, but we are family. And family does not stand by and watch others in the family suffer without making themselves available to be able to aid the process.
She underscored the critical importance of the Caribbean community to maintain stability from the Bahamas in the north to Barbados in the east.
The visit to Guyana by the chairman and members of the CARICOM Heads of Government Conference coincided with a ruling by Guyana's acting Chief Justice, Roxanne George Wiltshire, on the injunction against the Guyana Elections Commission. The People's Progressive Party Civic had moved to the court to block GCOM from declaring the results of the regional and general elections before the full verification of Electoral District 4. In setting aside the returning officer's declaration for Electoral District 4, the judge called on all political parties to show greater responsibility and respect for each other for the process to conclude. Don't forget, these and other stories are on the CARICOM news site at today.caricom.org or the CARICOM website at caricom.org.
Like us on Facebook, follow us on Twitter, and be sure to subscribe to our YouTube channel. See you next time.